All right, the next item is item number 2, a briefing and discussion on issues related to homelessness. And we have our Chief Strategy Officer, Diana Gray, with us, who will be doing a presentation. Thank you.
Thank you, folks. While we bring the presentation up, I will let you know that today the bulk of the presentation will be delivered by Audrey Muntz, who I believe is present in chambers this morning. And the topic of our briefing is the process we have been going through with performance management from the Financial Services Department regarding the management of homeless encampments. As we have reported previously, we started this process in the fall, really recognizing that there was very significant activity in this realm, both related to enforcement of the both local and state camping ordinances, as well as cleanup of abandoned encampments, cleanup around existing encampments, and really a need to provide some infrastructure to ease the coordination between departments and to clarify really what the process is, particularly around prioritization. Next slide. So as we move through this presentation, I'm going to briefly describe current state. I've reported on this before, but give some sense of the volume of work that is occurring across departments. And then I'll hand it over to Audrey Muntz, who will review our process, the recommendations that are currently coming out of that process, provide a progress report, key deliverables, and timeline, and then certainly ask for your feedback on that. Before I move on, I just want to take a moment to thank Audrey for coordinating this process. As you will hear, there are many, many stakeholders in the process, and she has just done a fabulous job of laying out really what some of the pain points are, areas we have for potential improvement, and guiding us through the process of building a structure that we think will be much more efficient moving forward. Next slide. So in our activities related to public space management around homeless encampments, we have over 10 departments that are regularly participating. Those include departments that are tasked with actual cleanup related to clearing sites or providing cleanup of existing sites, cleaning up abandoned sites. Of course, Austin Police Department related to those sites where enforcement is occurring, and significantly Parks and Recreation, as they are the landholder on which many of these sites are located. There are quite a few other departments, which Audrey will give a summary of, who touch different efforts depending on the location. But these are 5 departments who are spending an immense amount of time and effort on these initiatives. We still are in a scenario in which requests for service far exceed capacity. As you know, there are hundreds of encampments throughout the community, and our departments are working really at capacity to respond to requests for services. And so I've provided here some indicator of that volume. The 3 departments that are particularly tasked with the cleanup of refuse from abandoned encampments when there is enforcement and folks have left some of their items behind, or even cleaning up around some existing encampments for health and safety reasons. And so what I've provided here is the average monthly number of sites serviced, as well as the average monthly amount of refuse that is collected in tons. So on average, between Austin Resource Recovery, Public Works, and Austin Watershed, that is 68 sites and an average monthly tonnage of 138 tons. Again, we have many other departments that are visiting encampments, potentially carrying out smaller cleanups, et cetera. But I do just want to lay out that this work has been going on in a robust manner. And so the process and the discussions that Audrey is going to be giving you an overview of today are not about starting this work, but rather creating a process and an infrastructure that allows us to clearly identify what our priorities are and support staff as they move through the process. With that, we'll go to the next slide and I'll hand it over to Audrey.
Good morning, and thank you, Diana. So as Diana mentioned, there is an incredible amount of work already happening in the homeless encampment management space. They've been doing this work for many years, collaborating and partnering to improve the process. But given the changing laws over the past year and a half, as well as the additional constraints on social services, including shelter, it felt like an opportune time to bring together these departments and look how we might better collaborate across the city to take a citywide approach to homeless encampment management. And so the Homeless Strategy Division, with the support of then Interim Assistant City Manager Ann Morgan, tapped our office, the Financial Services Department Performance Team, to begin facilitating this work in November of last year. And so we pulled together the 15 most impacted departments to take on this opportunity to improve and streamline homeless encampment management. And so in November, we began planning and discovery work so that we could identify the multitude of pain points that departments were experiencing in homeless encampment management, and I'll discuss those in just a moment. We then wanted to understand the current state of homeless encampment management, so spent some time mapping out the process so that we could identify ways that we could potentially simplify or collaborate better and build a future state that was easier and more effective. And so today I'll be sharing with you the progress that we've made on the recommendations that came out of this work and discuss a few of the recommendations that are moving into the piloting and implementation phase. And I do just want to say thank you to all the participating departments that you see here on the screen. They've been incredibly engaged in this work while they have continued to do their work in the field. So it's been an incredible effort, and people have taken a very human-centered approach to this work, and so I just want to express my gratitude to all of the team members. So I think we skipped a slide. Back, please. So during workshops and discussions, departments did identify numerous pain points. We also pulled out a number of pain points when we mapped out the current state of the process. You'll see here on the screen the pain points that were the most common that then drove our ideation and generation of recommendations that I'll share with you in just a moment. But in the current state of the process, there is a lack of a unified citywide approach to this work. Information is flowing into departments from numerous sources, and each department is managing its response and prioritization in their area of expertise. And so the team wanted to find a way to make sure that we applied a citywide lens to this work and prioritize those camps that were presenting the highest risk to safety and health at a citywide level. Current state large cleanups are extremely collaborative in nature. However, much of this collaboration is happening through emails, phone calls, meetings, or within a department's internal process. And so the team saw opportunities to make this work more transparent. Additionally, when a camp is cleared without housing available, then that does create a cyclical nature to this process, with persons experiencing homelessness moving to private or public land and triggering this process for either the same department or another department in the city. So in designing improved state, we wanted to make sure that we thought about future impact of closures and again took on that citywide lens when considering action. And additionally, departments did describe accelerated burnouts on contracts, as well as having to divert staff time and resources away from other projects or activities to be able to do this work. So as we develop a process that's citywide, we want to make sure that we're using our limited resources in the most efficient and effective way possible. And here in the middle was the biggest pain point staff identified, which was having to displace people during disclosures versus being able to provide shelter or housing. We did deem this insufficiency of resources out of scope of this project, as there are other teams and departments working on increasing shelter and housing, and we wanted to stay focused on improving the management of homeless encampments and response to those encampments while we await for those additional resources. Staff, as associated with this and the cyclical nature of this work, did describe feelings of being burnt out. We do hope this can be alleviated, at least to some extent, through the creation of more efficient processes, as well as by creating consistency through citywide protocol and additional training for staff. Within the technology space, departments are using numerous data systems with various levels of maturity to collect information about encampments, and they're collecting different types of data, so different types of fields, which can make it difficult to get a citywide picture with the current technology that we have. And all of these pain points do lead to it being difficult to communicate a consistent and clear message to the community and persons experiencing homelessness. And so we're aware of that as an additional pain point as well. And next slide, please. And so as a recap of the recommendations that came out of the discovery work and ideation workshops with those 15 key departments, the team did feel that it was key to accomplish this top recommendation of a central response structure first, as it will provide the framework, guidance, and oversight for the team to be able to accomplish these additional recommendations, which include coordinated prioritization and resource deployment, a communication plan that considers communicating to persons experiencing homelessness, the public, as well as between departments, standardized citywide protocol that tackles some key issues like biohazard cleanup and property, a central hub for staff resources where this central structure and information can live, as well as increased staff training, and then finally a technology system that can take a citywide lens for tracking camps, prioritization, resources, and response. Okay. I do want to, okay, we can go on to the next slide, please. And so I do just want to say, as we continue to make progress on the recommendations, I do believe we will be able to minimize many of those pain points that I shared earlier. But I do want to acknowledge that without the root cause solution of housing, that many of those pain points, including the cyclical nature of the work, the trauma of repeat displacement for persons experiencing homelessness, frustration from community members, and challenges managing limited resources will remain to some extent. But I am hopeful that we can improve the process through these recommendations currently underway and the work that we will continue to do. And so now I'll highlight these recommendations and then share some key milestones that we've achieved in the last couple of months. We are currently working on 2 of the recommendations with cross-departmental work groups, tackling both the central response structure as well as the homeless encampment management prioritization tool, which supports the tracking and prioritization of encampments using a citywide lens. The team felt that it was important to do this prioritization tool in parallel with the setup of the central response team, because this tool will provide insights into encampments that support decision-making with a citywide lens. Next slide, please. And so again, to reiterate the value of this central response structure, it allows us to apply a citywide lens to encampment response so that we make sure to prioritize resources to encampments that present the highest risk to health and safety. By having a cross-departmental team, it will support consistency in encampment action as well as improved communication to departments. I also think as it begins to do its work, it will improve our communication with the public and persons experiencing homelessness, because we'll have a clear structure and process for how work is being done citywide. So the progress that we've made thus far on this recommendation is that the mission, preliminary goal, and objective and guiding principles have been established. I'll share those in just a moment, as well as an organizational structure and governance for that team. The leadership team has been underway in developing these mission and guiding principles. However, there is a dependency on that prioritization tool to activate the team as we fully envisioned, but we are considering the tasks of this central response structure complete, and this phase, we're going to close out this phase and actually activate the team midsummer when that tool is implemented. Next slide, please. And so we're referring to the team that came out of the central response structure development as the Homeless Encampment Response Team. It is a cross-departmental team with the mission of providing a coordinated cross-departmental city response to encampments that prioritizes the health and safety of all Austinites and strives to preserve human dignity and respect. with the guiding principles that everyone experiencing unsheltered homelessness deserves to be treated with dignity and respect, that every effort will be made to connect individuals experiencing unsheltered homelessness with available resources and housing, recognizing limited availability. When determining interventions, the Homeless Encampment Response Team prioritizes safety and health while also considering impacts to infrastructure, property, and environmental health. Inclusive and equitable public space management recognizes that the public space throughout our community is used for a variety of purposes and should be clean and accessible for all. Next slide, please. The team also developed a preliminary goal of reducing the negative impact of encampments with the associated objective of reducing acuity of encampment scores. We will update how exactly this is measured as we progress further in the development of that prioritization tool. But if we're achieving our goals and our strategies are working, we should see a reduction in the acuity of encampment scores towards this goal as we do our work. As the team matures, there'll be additional opportunity to develop goals and objectives, but we want to understand trends around encampments at that citywide level, as well as what we can influence and reasonably track prior to the development of additional goals and objectives. And so the team will develop additional goals and objectives as time goes on. Here is the Homeless Encampment Response Team structure, modeled to some extent off of an incident command structure. Each of these teams and sections is cross-departmental, having representatives from some of those key departments I showed on that early slide on each of these teams. The leadership team is responsible for establishing goals and objectives and setting long-term strategy, and will review the work of the sections below, including reviewing and approving camp prioritization, response, and operational plans. The planning section will maintain situational awareness of homeless encampment citywide and develop prioritization and response plans that then can sit up to the leadership team for approval. This team or this section will be the owner of that homeless encampment prioritization tool and use that tool to help guide decision making about what camps should be prioritized based on risks to health and safety that's captured as part of that tool. The operational and logistics section will be activated as needed when a camp has been selected for closure and will be chiefed by a SPOC from the land owning department, and will work again with a cross-departmental team to develop operational plans, including identifying resource needs and commitments that then get sent up to the leadership team for approval before this team carries that out. And finally, the policy section will be activated as needed when the leadership team or another section identifies a gap in a policy or procedure. Obviously, in the short term, this policy section will have a heavy lift as they develop homeless encampment citywide policies and procedures, including closure protocol, biohazard, and property procedures. Next slide, please. So this team will be supported by this homeless encampment prioritization tool, which also applies that citywide lens to encampment response and supports consistent data capture across encampment citywide. It'll help improve our understandings of needs, risks, and trends across encampments because all teams will be using the same tool. It's modeled using the HEAL prioritization tool. We didn't want to start from scratch. That team has already done incredible work on collecting information about hazards within encampments as well as vulnerabilities. And so we have updated that tool so that a single tool can meet prioritization for closure both with and without HEAL. And so we didn't want the teams out in the field having to use two different tools, so we have created a single tool for both of those. We have finalized scoring and got a preview of the tool yesterday from CTM, and we'll begin testing next week. So CTM is supporting the creation of this tool, and we'll work to refine it over the next months, including making sure to adjust any questions or weights to meet our needs with an estimated implementation in early July. Next slide, please. And so here's a snapshot of the progress we've made thus far. As I mentioned, we're considering that central response structure phase complete. It goes hand in hand with the launch of the launch of that central response team goes hand in hand with the coordinated prioritization and resource deployment. And so we are considering that underway, and we'll be better able to do that once that tool is implemented midsummer. The communication plan we have not begun tackling within the performance management process, but CPIO has established a joint communication team with other PIOs to coordinate information across departments. And APH has recently hired a PIO to focus on homelessness communications. The group is working to unify messaging, including updating the website to help inform citizens about what they can expect regarding the city's response. The standardized protocol, citywide protocol, we are going to activate that policy section in the next couple of weeks to begin working on standardized protocol, starting with the homeless encampment closure protocol. We have not begun work on the central hub for staff resources. Within increased staff training, departments are sharing resources, and training has increased in some of our partner departments. And then finally, the technology recommendation. We do have that system for tracking camps and prioritization is the tool that I have been discussing, so that is underway. And once we have iterated and worked that tool out, we'll then explore how we can better track resources and response within a technology solution as well. Next slide, please. And so here's our timeline. You'll see within the central response structure that we completed the tasks that we've identified within the homeless encampment prioritization tool. We're working on developing a deployment plan as well as training materials for staff and testing it with CTM to make sure the tools can meet all of our many teams' needs. And then finally, within protocol development, we'll start with an operations template. PART already has an operations template that they use that's very mature, so we'll lift and shift that so it can be used across the city by different departments. And then we'll work on tackling this encampment closure protocol. There's some topics like property that will take us a long time to work through, and so we've given ourselves a long runway to get through that because we want to make sure that whatever we put in the protocol that we can actually do in practice across departments citywide. And that's it. Thank you.
Wonderful. Thank you, Ms. Muntz, for that presentation. Colleagues, questions? Councilmember Kitchen.
Thank you very much. I do have a lot of questions. I'll just ask one of them and then pass it along. And then okay. So the first thing that I want to ask is I want to understand how this. First off, let me say thank you. I know this is not easy work, and it's certainly not been easy work for all of the departments. And so I really appreciate the effort that is going into getting more organized across the city in terms of response. So the first question I have is I want to understand how this work relates to the placemaking intent or component. It's not intent, it's a component of HEAL. And I want to understand, is that managed, who manages that aspect? And what I'm talking about is that, you know, the HEAL initiative is designed to identify places, using the prioritization tool, and then work with people living in those places to connect them to shelter. But the other component, the last component of that is dealing with the location and making changes to the location. And so I want to ask, where is the conversation happening about placemaking? And I don't know if that's for you or for Diana Gray.
I think I can take that, council member. So I will say that as we launched the HEAL initiative, of course, the local camping ordinance had not been changed. And so rather than...
Could you, I'm sorry, I can't quite hear you.
Are you able to hear me now?
Yes. Mm-hmm.
Okay. That, given the advent of the camping ordinance, rather than clearing a few encampments at a time, we're servicing hundreds. And so it has not been plausible to do that work, certainly in all of the encampments that are being serviced and would be addressed through this process. And really the decisions around what to do post-resolution of an encampment have moved to the landholding departments and based on their resources and their priorities, because often they are looking at multiple sites that may have been the location of an encampment previously. I think we can potentially at a later time I will say that the resource landscape, given the significantly, we're talking about orders of magnitude, greater numbers of encampments being cleared, is something that we probably need to revisit and think about.
Okay, I need a timeline and a method to have that conversation. The HEAL ordinance, when it was passed, included as a step, as the last step, what I'm calling placemaking. That may not be the right term, but it was a component that clearly said that the configuration of those places would be considered and potentially changed. And so that needs to happen. And, we're a year and a half into HEAL. And so I just need to understand who is it that I need to work with to understand that that's going to happen or that efforts are going to happen. I know that there have been some efforts around some places, but what I'm not hearing is a systematic approach to that. And I understand my ideal would be that all these locations that HEAL would be available for all these locations. And that's a separate conversation that I've mentioned and others have mentioned, that we need to accelerate the HEAL program. But that's another conversation, and that has to do with shelters and other kinds of things in terms of resources. But what is concerning me is that we're not even doing all aspects of HEAL right now. We're not addressing the last piece. So I'll leave it there, but please let me know who I can talk to and who's in charge. And if it's going to be handled under this structure, that's fine. I just want to know where it's going to be handled, because I'm not seeing it anywhere in this presentation.
I do not anticipate it being handled under this structure at this time, council member, but I'm happy to follow up.
Okay, all right, well then we can handle it under whatever structure is appropriate, but I want to understand how it's being handled. So, okay, I have other questions, but I'll let others ask.
Thank you. And also wanted to note that we are joined by Councilmember Harper Madison virtually and Mayor Adler on the dais. Colleagues, any additional questions? Yes, Mayor Adler?
I appreciate the presentation and the organization and pulling everybody together, because it was feeling like a little bit like we're having kind of uncoordinated response as everybody was trying to put out the fire, as it were, and to be able to deal within their areas. And I think this will help a lot to coordinate it. I think that as you went through the pain points, which are the barriers for being able to go out tomorrow and close down all the encampments and put everybody into a place that will help them stay off the streets and out of tents. I think that's one of the most significant slides we have, because that goes to what the community is feeling. How do we get from here to there? And the work that you're doing and this response in setting up this organization begs the question of the most important element of that pain point, which was the people pain point and the insufficient resources or places for people to be able to go. And as soon as we're able to provide for that, I would imagine a lot of the other issues go away. Mm-hmm. There's less tonnage in encampments, there's less moving people around, there's less taking them from one place, moving them, and they show up somewhere else and have the same issue somewhere else. And you started off the presentation today by saying this is not something that is part of your presentation, but it is, and I understand the structure and what you're working on, which I think is very much needed. But, for the community, we need to recognize that there will be no answer to this. There will be no disappearing of encampments. There will be no thorough and exhaustive placement of people into homes until we have places for people to be. So I really appreciate the work that Diana and other folks, the county, are doing to start putting units on the ground. And unfortunately, we could have been doing this, years and years ago to build out the infrastructure so that we had that infrastructure in place, and we don't. So we're now trying to catch up. But at some point, we need a presentation, and I'd recommend, Madam Chair and Madam Vice Chair, that we have a presentation that just really speaks to what is the arc and the time frame and the prospects for actually having the units available, because there's a dramatic increase in the number of units that are going to be coming online over the next 3 years relative to anything that we've done before. And the community needs to both see that that's going to happen, but also see that it doesn't happen overnight, so that the community can have a realistic assessment. This council initiated a lot of that work with our ARPA spend. The county joined and matched us with the ARPA spend, and organizations like HACA redirected their resources for that. And there are asks out in the community now that hopefully will get us that last 100 million of the 500 million. When we have that, then we've laid out that path really to get to that system build out over that 3-year period of time. But I think a presentation on that, because I think that's really the question a lot of people are asking. And I would just comment, there was media reports here about some encampments that we now see up in Williamson County. I haven't quite figured out yet how the judge thinks that us owning a vacant building has created an encampment in Williamson County, because us owning a building doesn't create encampments there. But the truth is there are encampments in Williamson County too, because this is not a challenge that is just one in Austin, but it's a regional challenge. And I hope that to ever greater degree, we're working with our regional partners to deal with our common challenge of encampments that exist all over the area. So thank you for the presentation.
Thank you, Mayor. And Chair Tovo?
Thank you very much. This is really helpful to have an overview of the process that you've been undertaking, and I agree that it is really necessary to have this kind of streamlined approach. I have a series of questions. I guess my first is, as you look forward to having this team up and in place, are the contracts that we have sufficient to support the work? My guess is that this increased efficiency will really help. But I know that you've also run into some limitations with the contracts. We had an opportunity in one of our conversations at council, I think, or at one of our public health committees, to talk about the encampment in Bolden Creek and West Bolden Creek. That was part of HEAL, and individuals were connected with housing, and I believe most of them moved into that housing, but there was quite a lot of items left behind, and the contractor was not able to come in for multiple weeks, and in that time there was actually a fire in that location. So so it's really a question of resources. How much will this streamlined process really help with efficiency? Are we still going to be facing the limitation of resources in terms of the kinds of contracts we have for doing this really, really challenging cleanup work?
I think I can speak to that, and then I'll invite Audrey to add to it based on her observations. So we do have several resources for cleanups. That includes both city staff through Austin Resource Recovery, for example, and contracts that Public Works and Watershed Protection, for example, hold. And then, there are additional staff that come on site, particularly from the land holding departments. I do think that we will likely see, based on the utilization of resources to date, some need for additional resources in those contracts. But departments are looking at their resource array to see whether there are resources they can draw from other places to support the work. I think the other piece that has been challenging is that Public Works, Watershed, and Austin Resource Recovery, depending on the funding source, can use those contracts or staff only in particular places, right? So obviously, and so I think that resource coordination is something we're really hoping to improve, figuring out, really looking at the crews that we can use in a particular location, and seeing if we can alleviate, the situation that you just described, where either we have a site that a particular team needs to address, or there's so much work being done on a previous site that's already underway that we have a delay. I will say that for the most part, we have not had a delay just because of the reason that you have described, not only, in that case, the danger of fire, but of reoccupation. So in most cases, we have been able to start cleanup, the day of or the day after an encampment closure, and that's certainly our goal.
Thank you for that. So watershed protection, as I remember, and they were really the first, as I recall, the first department to come forward to council with this idea of having these contracts. So their contracts are specifically for areas that touch on bodies of water. Is Public Works, I think you cited that Public Works has some restrictions as well. Can you tell us what those are? Or if you could get back to us about that, I was
Right.
interested in knowing that. Throughout, in part of the presentation, it was noted as a goal to reduce the acuity of some of the sites. My sort of layperson's takeaway on that, could you tell us kind of what that means?
Audrey, you want to take that?
Yes, so that we're hoping that if we tackle camps that are the highest risk to health and safety, that we'll see the scores decrease over time, and that the team having this full citywide picture can also identify other strategies that might be able to reduce encampments acuity if a closure cannot happen for a longer period of time. So if there's a high trash load, that ARR could go and do some cleanup, or if there's ways to for fire to go in and reduce fire risk, that there's other strategies that could be taken, and we're still working out exactly what that will look like, and we'll be better able to develop that strategy once we have the data from a citywide perspective and have some of the additional details that we'll be collecting in the tool that isn't currently captured in some of the prioritization tools from departments.
Thank you, I appreciate that. And I have one last question. This tool and the conversation really focuses, it sounds like to a large extent, on some of our larger encampments. Can you help address how nimble this team will be at responding to smaller, potentially even just individual encampments, but that are taking place in areas where there needs to be full public access? And let me give you a couple examples. One comes from the Children's Alliance Garden. That falls within District 9. We've received recently quite a few comments about individuals camping in that area, including somebody who wrote in over the weekend to say that there was somebody camping in one of the children's tunnels, one of the tunnels that's part of the playground equipment. At Ricky Guerrero Park, there's that is the park that is also in District 9. It sits alongside Meadowbrook Development as well as Mainspring Preschool, and there's a very nice park with a water feature. I've suddenly forgotten the name of that. And there were several individuals camping in that area. What I hear again and again from our community is that in those cases where you have very well used public assets, there really should be a more immediate response. I don't know the extent to which there's signage in some of those kinds of places, or more immediate education of individuals who are in that area that this is not a place that's allowable for camping. But since the presentation is really focusing on those larger encampments, can you help me understand how those how the examples I'm describing interface with that, and how we as a city are going to respond to those.
So for the tool, one of the things we want to do is make sure to have a prompting page. If it is something that is an obstruction to access, like obstructing the access of a library directly on an amenity, then that isn't a camp that will be scored. That prompts some additional action and instructions for the person, the staff person on site. That would be voluntary compliance for movement, and then additional steps if voluntary compliance isn't achieved. But that though, and that's something we want to make sure that we work into the citywide protocol. These kinds of things that are not, that would be immediate action from staff versus a scoring situation that would then be filtered into a prioritization for later action.
I think that's really important, having seen some of the letters that go out to constituents. You know, it is an unsatisfactory response to talk about, you know, that we have a matrix and we're scoring. I mean, when there are situations like that, I think they want a more immediate response. And again, it's a better strategy to kind of address it early on before there is a larger encampment there. So how is that the current practice? Well, no. I guess how soon will that be? Will that part of the practice kind of be in place?
So what has been described to me by PARD, and I know we don't have any PARD folks here, is that if they see someone that is on a playground or obstructing entrance, you know, at a library, same situation, that they would follow the steps that we're going to capture in protocol, that they would ask for that voluntary compliance right away, and then move to additional action if voluntary compliance isn't achieved. I think that the difficulty is that if someone is on a playground and a PARD person isn't there to see them, that someone may come upon a person camping on that site prior to when a staff could be at that site to ask for that voluntary compliance. And so that, I think, is a piece that we would can kind of think through.
And I think if I should just clarify, and then I'm gonna be quiet. It sounds like that is the practice, but that PARD is woefully understaffed to provide that kind of outreach. And so I would raise this to the attention really of the team, but also our city manager, that's an issue that needs addressing, since a lot of these instances are happening on parkland. Really needs to be additional support for PARD.
Thank you, Chair Tovo. I have just a few questions on my end to ask as well, and I appreciate the presentation. I think it's important that the public knows and is aware of the review that staff has undertaken and looked at improvements that can be made and will be made to our process in reducing homelessness and transitioning our unhoused neighbors into housing. And I appreciate the focus on creating a centralized response structure, as well as doing implementing a prioritization tool that would be utilized across all of those 10 plus departments that are engaged with when there is a relocation involved. One of the items that you cited as a pain point was insufficient resources to meet the need for people experiencing homelessness. I wanted to ask where we are in our shelter bed capacity. I know that a few months ago, a lot of our shelters were operating at half capacity due to COVID. So I'm curious if we received an update on the expansion of the availability of the shelter beds.
So I see that Director Stirrup is on the line, and I know that there have been conversations with the medical authority and the shelters about the potential for that. And I believe she's had the most recent conversations related to that.
Thank you. Director Stirrup, are you able to speak to whether or not there's been an expansion in the shelter bed capacity?
Good morning, Adrienne Stirrup, Boston Public Health. We are still in conversations with the Arch about expanding the capacity. They have undergone some staffing changes there, so we are helping them navigate those and getting to a place where they will be able to admit more clients. They report that they typically are serving about 60 per night, and that seems to be the current demand. They understand the need to have the additional capacity to support the work that's going on with the HEAL program. And so I hope to have some updates this Friday. I'm meeting with the board and leadership to finalize those plans.
Thank you. Yes, that would be great if they're able to expand their capacity, because ultimately when people receive their notice to vacate, we need to have somewhere, some form of shelter for folks to go. So that would be, I'll be following up with you to see how that update goes. The other question I have is for the, I was glad to hear that we have a PIO officer, Public Information Officer now within the Homelessness Strategy Office. Can you share the name of that individual?
Chrysola Webb.
Yes.
Is it Christella Webb?
Chrysola.
Chrysola.
CH.
Chrysola Webb. Okay, thank you. And I know you all hosted some community meetings this past week, or was it last week? Can you just share how they went? And then I'd be curious for your thoughts on how the community has been engaged on this process of our department looking at the improvements to how we process and respond.
Yes, so we had 3 community sessions, update sessions, starting, I believe, on the 1st of May. Had one during the day, primarily with providers and advocates, and then 2 evening sessions. We had, I believe, a total of about 250 people attend those sessions, which were virtual. And this really grew out of the community engagement that we did around ARPA funding at council direction back in October before we presented the spending framework. So we were able to update on a number of fronts, certainly on the solicitation process for ARPA funds, which I think people were excited about, had some interest in. We talked a bit about housing production to Mayor Adler's comment about what we anticipate being a market increase in units available. There continues certainly to be concern about enforcement in general without access to housing. And so, as well as some input about people who are concerned that enforcement's not happening fast enough. I think the piece is that the community is most interested in, aside from PACE, particularly folks who are in the advocacy or service provision space, are, in addition to how can we expand shelter and housing or accelerate it, how do we ensure that people are being treated respectfully when enforcement occurs, that their property is being protected, that sufficient notice is given, that whatever services do exist in the community, we're connecting to them. So we felt like it was a really productive conversation and have committed to doing those community updates quarterly that are open to anyone in the community to join.
That's great. Thank you. I really appreciate doing those updates quarterly. That'll be a good touch point with the community, especially as we continue conversations of how we're spending our ARPA dollars and providing additional housing. All right, colleagues, any other questions on, yes, Councilmember Kitchen.
Thank you. I have another question about the, just for my clarity and the public's. So what is, I think this is probably part of what y'all are working on. How does the public best communicate if they want to report or identify an encampment that's, that's a safety risk or health risk, or what do they do?
So I would say that right now, the most unified way that we have of tracking those requests is 311. With the acknowledgement that that does not mean that someone is going to be able to respond absolutely immediately because we just have so many encampments. But this is something that we will be looking at in this process. The way that 311 is currently structured, the information that we're getting and how that's dispatched to the various departments that might be involved, because we know that folks are taking multiple avenues to communicate their concerns. Sometimes, quite frequently, there's duplication, which can create some confusion. And we want to also ensure that we're reliably getting that information to the departments and staff that should have it on hand.
So is the thinking that, there's a slide, the phase 1 central response structure. So is the thinking that, understanding that it won't always happen this ideally, but is the thinking that that a community member might call 311 and that those calls will be routed through this leadership team? Is that what is meant by the central response structure? And then the leadership team will route it to the right team? I'm trying to understand how the central response works.
So let me give you my answer, and then also Audrey may have input.
Okay.
I think that within the organizational structure for the central response that we have established, the leadership team really is about decision making, right? And approving action.
Okay.
The team or the section that is most relevant to input about particular encampments is the planning section, which maintains the tool. So I think the mechanism that we need to identify, one of the mechanisms, is we have a tool that is recording encampments that have been assessed, right? And where they are in the priority list. What is the input process? We're aware of a lot of encampments and that need assessed or have been assessed. But I think that the process where let's just say there is a new encampment or there are new concerns or potentially something that city staff is not aware of, feeding that into that planning section for identifying an encampment that needs assessed or reassessed is how I would view that happening. Audrey, do you have other thoughts?
No, that's our thought. So that'll be in a future phase. We wanted to make sure we had the back process to support the inputs. And so that's why we tackled the tool and the structure first.
Okay. Well, the reason I ask is if from the community perspective, and I know you guys are working on this, that's a real need to understand, because what's happening now, and it's also important for our offices to understand, because what's happening now is there's a lot of different, I think you mentioned this, there's a lot of different avenues that these questions and concerns are going to, and they're duplicative, and then there's a lack of understanding about what should a community member expect in response, and for our offices too, what should we expect in response? So we want to be efficient, in terms of how that information flows. So, so it sounds to me like that is something that y'all are, you're working on. Can you give me an idea of the timeline for working on that piece, or have y'all figured that out yet?
We have not figured out a timeline yet.
Okay. I would just urge that is really, of course, this whole thing is important. I understand y'all need to put the structure in place. But that is one of the biggest concerns that I hear from the public, and my office has also, is who do we talk to and what are we supposed to expect in response? And because it's just going to continue, we talk to a lot of different people because we're not sure who we should be talking to. So if you all could let us know, I know you need to give some thinking, but give us a timeline so that we understand when that question will be addressed. So I'd like to ask for that just as a follow-up item. And then I would like to understand also as that follow-up item, how will our PIO officer be involved in communicating that particular piece to the public? So that's the follow-up that I'd like to understand. Okay, and then again, I just want to thank you both. I know that Diana, Ms. Gray, you and your office are working very hard on all aspects of this. As the mayor mentioned, the name of the game is to get housing and shelter in the meantime, and that's very difficult, very difficult. So I know that there's a lot of efforts happening on that regard, and I appreciate the efforts that are happening around getting some organization to our response to the encampments. So wanted to say thank you, and I also want to reiterate, and I know you guys know this, please let us know if there's something else you need to make these things work. That's important because we want to be here to be helpful with that. So, all right, thank you.
Thank you. And thank you. Thank you all so much. Thank you, Ms. Munson and Ms. Gray for the presentation. Great conversation. Okay, colleagues, we're going to move.
Vice Chair Fuentes, my hand is raised.
I'm sorry.
I have a question.
Yes, Councilmember Harper Madison.
Thank you, I appreciate it. So I really appreciate this presentation. I think it's relatively thorough and comprehensive. I really appreciate that it seems as though the priority is the communication piece. I think often as a municipality, that's our primary issue, is having all the departments work well together. The one thing I'm not seeing that I think is relevant and important is the recognition around collecting the data around people experiencing homelessness and mental health disruptions and substance abuse disruptions. And so on the training component, there's a slide that sort of talks about next steps, and it says training. And I wonder if some of that training is to, produce people who are eligible to be considered community health workers. I wonder if that training is including folks being able to recognize when people are experiencing mental health challenges and need a different kind of referral or wraparound service. Because, we can produce all the housing we want, but the truth of the matter is there are a lot of folks who are not going to remain housed, and it's primarily because of an ancillary issue, with substance use disorder or mental health. And so I'd like to know what's our plan for addressing that and collecting the data. Because truth be told, not only do we not have enough housing, I don't think we have enough capacity in the way of, treating people with mental health challenges. And I mean, that's inpatient, intensive outpatient. I really just don't think we have enough. And in my mind's eye, they should be parallel to one another.
Thank you, Council Member. So I think it is true that the sort of unit of analysis of this process is how do we address an encampment when it is going to be cleared, whether that's heal or, so it is the practical work of that. However, it connects to really the people side. And here are some ways that I think that will manifest. And one of the things we hope is that as part of our protocol for when an encampment is there's going to be some intervention there, that we are ensuring that outreach is going out. Oftentimes, if the location of the encampment allows, that would be a host team, right? Who have integral care staff, who have DAC social workers, as well as APD and EMS, so that we're identifying the folks in the camps, and they do have their own data system which tracks sort of interactions with individuals. Another thing, and part of that outreach that we really want to press, that this is part of our current open solicitation to try to expand citywide outreach, is that we're ensuring that coordinated assessment happens in the field so that people are essentially in line for services or connected to existing services. I will say that one of our biggest providers of both rapid rehousing and permanent supportive housing is integral care, and we do ask other providers to ensure that they have explicit connection to clinical care, whether that's through integral care or a private provider, because we know that behavioral health needs are really very prominent among the population. And then finally, that in the third solicitation that will come out through APH, we have set aside some dollars explicitly for behavioral health that is not necessarily attached to permanent housing, but could be utilized in these interventions, among the unsheltered population.
I appreciate that. Thank you very much. And I appreciate that you're thinking about it, because again, we can provide all the housing in the world, but if we're not addressing sort of the root cause of people becoming homeless and experiencing homelessness, on multiple occasions, I think one of our goals is non-reoccurring, right? And so, yeah, I really appreciate you recognizing that. I would like to know if you happen to have the data about how many of our residents experiencing homelessness are challenged with behavioral health challenges. Do you have any sort of data?
So I think I'd like to come back to you with that, council member. I think we have a couple of sources. One is self-report, which you can imagine is probably lower than the actual prevalence because of stigma. Not everyone wants to tell somebody who's collecting data that they are living with a behavioral health disorder. I will say, our indicators are it's very high, right? It's probably greater. It's greater than 50%. And for example, among integral care clients, it's very common that there are comorbidities of both mental health and substance use disorders. And of course, we have lots of folks with physical disabilities as well. So lots of co-occurring and trimorbidity in the population.
I look forward to the follow-up conversation, and I'll leave with this. There's a community in my district that has some challenges with a long-time, homeless population. And there's a particular neighbor who happens to be a part of the neighborhood association who took it upon himself to open his house. And, he's renting out tools, basically, so tools don't get stolen out of people's shed. He's providing vests and jobs. And, I think at that community level, what he's doing is helping dozens of people. And I want to figure out how we can duplicate the model. He just happened to be innovative and want to be a part of the solution. He heard some folks in his neighborhood complaining pretty repeatedly, and he was complaining too, and just decided, I want to be a part of the solution. So they're having an event this weekend. I would love it if you could join the event. They're bringing Integral Care and APD and, several other local officials. But I definitely think it's an organization and an initiative that we should take a look at and see if we can, really encourage other communities. Because as in terms of limited capacity, you guys can't do it all, and council can't do it all. Nobody's going to be able to do it all. We have to collectively, address people experiencing homelessness as a community. And I think that would be a good way to start and offer people some empowerment by way of really participating in addressing the solutions for, problematic elements in their community.
Thank you, Councilmember.
That information. Thank you.
Yes, I believe I'm familiar with the organization you refer to, and I'm really encouraged by their model. And we may want to invite other council members as well to take a look at what's happening, because I think that it is a really exciting strategy that's totally neighborhood based.
Absolutely. Thank you.
Thank you. Thank you both.
Thank you.